We're going to talk about AbbVie. U.S. drug maker AbbVie is getting some unwanted attention. Of course, it's unwanted by them, but then again, they kind of deserve it. This is an article from the Daily Mail. AbbVie made $114 billion on Humira by litigating its competitors. AbbVie raked in at least $114 billion over the last 7 years by setting up a complex series of patents around Humira. Is that I'm saying it right? Humira?
Humira.
And suing any competitors that tried to enter the market with knockoffs known as biosimilars. Prices were expected to drop significantly for patients in 2016, but using its patent tactics, AbbVie managed to raise prices by 60%, costing some users up to $80,000 per year. We'll get back to this in just a second, but the point is the drug, Humira, was supposed to be available for generics or biosimilars, which I guess that's a separate thing. Mm-hmm. And instead of that happening, AbbVie used some squirrely methodology to create a whole bunch of patents and then sue everybody that came anywhere near their product. Is that correct?
Yes.
Okay. All right. I'll keep reading here. AbbVie has raised the price on Humira 30 times since it entered the market and made at least $208 billion, according to the New York Times. More than half of that was made since 2016. 2016 was when the biosimilars were supposed to come on the market. But AbbVie applied for a litany of patents, at least 311 patents, 165 of which were granted, surrounding Humira's process and formulas in an effort to extend patent protections. Whenever a biosimilar attempted to enter the market after 2016, AbbVie bombarded the company with lawsuits and allegations that their patents had been violated. Since 2016, AbbVie settled lawsuits with at least 10 biosimilar companies, according to the Times, each of which agreed not to enter the market until this year, 2023. Operating with near impunity, AbbVie jacked its prices up on customers who desperately turned to Medicare for help, in turn saddling taxpayers with the cost. One study found that between 2016 and 2019, Medicare paid $2.2 billion with a B more than it would have had biosimilars made it to market in 2016 as they were supposed to. Since 2016, AbbVie settled lawsuits with at least 10 biosimilar companies, according to the Times. So this is crazy to me. Isn't the whole point that we're supposed to be able to get the biosimilars or the generics or whatever so that these prices can come down? I understand that they need to make a profit and recoup cost of research and all that stuff, but this is
what happens,
wild.
This is very common in terms of the end of what would be the main patent for a drug company to pull these tactics. This is exceptionally intense for multiple reasons. One is just the price of the drug itself.
Yeah.
So a year of, if Lipitor did this, let's say, $300 a month for somebody, these drugs are $7,000, $10,000, $13,000 a month.
Wow.
So the magnitude. Second of all, the fact that it's a biosimilar is analogous to a monoclonal antibody drug, which Humira is, that a generic drug is to a brand. So we can use the term interchangeably, even though scientifically they're different. But the process of making and the end product itself, that's why it's a biosimilar instead of a generic, is so much more intense that it's much more easy to find ways to say, hey, we do it this way, patent this. It ends up like this, patent that.
Wow.
So there's so many more. A generic drug, really all it has to do is be the identical chemical.
Yeah.
It's on its chemistry lab.
Right.
Whereas the biological drugs, just like the words implying, it's more biology. They're rearranging DNA and altering DNA to be specific, to perform a very specific function in the body. That's what kind of a biological drug is versus a chemical that's in your bloodstream. It can have multiple effects. So that's what these tactics are the same, but they're exacerbated because of the complexity, the price of the biological drug.
Yeah.
But again, this is done. AbbVie's done this with other drugs. All these drug companies do it. So this is normal. It's just the ramifications of this are even more intense.
Yeah. It wasn't that they just were able to hold off competitors a little bit longer. It was 7 years.
Yeah.
And they kept all biosimilars off the market.
Yeah.
And they started raising prices.
Yeah, and a lot of this too, and there's a lot of different angles we can go in, and we will. But when you look at the specifics, they're saying that they basically settled with these companies. Like whatever, I'm just throwing out numbers, but this is how something like this would generally work. Hey, if we win and our patent should go till 2017. 2027, you can't make your biosimilar till 2027. But if we lose, you can make the biosimilar now. So let's come to some financial agreement or some wink that in 2023 we'll let it go because we're not sure which one of us is going to lose and which, how much we want to pay our lawyers. So those kind of things occur where nobody won or lost, but 2023 was this date that these two companies agreed on. And that ends up harming people because the bottom line is the cost of what is still in the system is so high.
Yeah.
So Medicare gets hurt, and private insurance get hurt. People with high deductibles, high copays all get hurt by these backdoor dealings.
Yeah.
And then further, the backdoor dealings that I find even more awful, honestly, are the ones that they do with the PBMs. And we've talked about this before, but pharmacy benefit managers are middlemen between a pharmacy and the insurance. So, for example, a pharmacy doesn't get a check from the insurance company. They get a check from the PBM who passes on a price to the insurance. And the PBM is holding all the money, basically.
Yeah.
They're getting the money from the insurance. They're paying the pharmacies. So in between there, they're marking up the price, processing fee, et cetera. But they're going to Humira and saying, hey, even if this biosimilar comes on the market, we will cover your drug, even though it's more money, because we don't care what Highmark has to pay. So we'll cover this drug for you if you give us a rebate back. So again, I'm going to use numbers.
And the copay will still be within reason to the patient.
Yeah.
It sounds like this is a $17,000 drug, but they're saying, hey, you'll get your rebate and your people will still pay $50 a month, $100 a month or whatever, or that kind of thing. Or there's a coupon or whatever. I guess practically speaking, that's how it'll boil down.
Yeah.
You hear these huge numbers and you're like, how's somebody going to get stuck with a $10,000 bill? Certainly some do, I'm sure.
Right.
Yeah. Real issue, the problem that comes in is when people have $5,000 deductible.
Yeah.
So their copay, like Donnie's right, it'll be 40, but they forget about the people who now it's a growing number have a $5,000 deductible, $3,000 deductible, or they go into the donut hole, how much quicker they go in. So they can sugarcoat it for the average person, and it's true. But the deductible people, the high copay people,
it's a mess.
It's a mess.
Yeah. So
again, I don't know what the numbers are, but basically the way something like this would work is you'd say, hey, the drug is 10,000, which depending on the strength, Humira can be a month. That they'll say it's covered. The biosimilar would be 4,000.
Yeah.
But what we'll do, AbbVie, we'll make your drug be covered, but you got to give us $2,000 for every prescription we put through. And we'll give $1,500 of that to the insurance.
Yeah.
So we'll look like we're passing on this rebate. Meanwhile, they're not really knowing about this biosimilar, could still save them more money. We'll pocket the $500.
Yeah.
And so that's the incentive. We see many drugs that are generics are not covered. And that's because
of these deals.
Rebates.
These backdoor rebates.
And they argue, the PBMs will argue they're not pocketing the rebate, but it's a trickle down effect of savings. They're able to pass down the savings to the health plan.
Right.
If you're saving the health plan, then the premiums are reduced. And so it's interesting.
But
it is very,
it's just hard because we don't know the exact numbers.
Right.
If Humira gave them a $7,000 rebate and it came down to $3,000 and they passed, $6,500 of it to insurance, then that would be legit.
Yeah.
Okay. But then, we don't know those numbers. Yeah. We don't know. And they're not doing that for free.
Right.
So, they're not trying to help Highmark. So if they are getting a rebate, even if it's significant amounts going back, they're keeping a lot in their pocket. I mean, they're a business. I get it, but
yeah. The other thing too, you mentioned about the settlements, and I assume unless I interpreted this wrong, there was something about royalties being paid past a certain year.
Yeah.
So even though they're biosimilar, even though the generic or the biosimilar company, they're able to produce it, sell it, it's in market, there's a percentage that goes to AbbVie.
Yeah.
Because they're the OG, basically.
That was
right?
another That was another
That's
article that was talking about how now that the biosimilars are theoretically hitting the market, on Wall Street, some people were going, "Oh, it's going to be real bad for AbbVie." But the reality is, because they own the patents on the processes to create all of these biosimilars, they're allowing these other companies to utilize their patents to make the processes to make the drugs, but they're getting a percentage kickback the whole way. So even though prices may come down a little bit or even a lot of it, it's probably still not going to hurt AbbVie all that much.
Yeah. Exactly. This is more of a question too, I guess.
Yeah.
So I guess what's like the end result here? Apparently all of this was well within the letter of the law.
Yeah.
And the company still will continue to do it. And it's capitalism. Like there's going to be a fight. There's going to be a fight. There's going to be pushback always with your product's about to lose its exclusivity. And, yes, we have other drugs in the pipeline, but profits are going to go down, whatever. I mean, everybody's dealing with that in small or large scale. But is this dissuading biosimilars from making drugs for the future? Point. I mean, I assume if I'm a biosimilar and we have to go neck and neck with AbbVie every time we, maybe utilize a similar technology, at what point are you just going to say like, the heck with it? Unless we come up with something new, I'm not even messing with them.
Right.
You know what I mean?
Yeah.
Right. I mean, that's a very rudimentary way to put it, but
that's a great point to piggyback that. Here's the issue. Generic drugs are the identical chemical. It's a chemistry thing.
Right.
You have to make this identical chemical, synthesize it, you're done. You have to pass safety and purity, those kind of things, of course. But the chemical part, you make that identical chemical, you're grandfathered in with all the clinical testing. A biosimilar, you're not. Yeah. Biosimilars take 5 to 9 years on average to develop, then another 12 to 15 months for approval. Generic drug, you get approved like that. They test the chemistry of it. So you're already fighting this huge uphill battle of the development of these. Now, yes, they're generic drugs that go for $20, $50, say $100, and the biosimilars going to go for $2, $3, $4 grand. I get that, but when you're looking at all this investment, and like Dante says, if all it means is you're gonna have to battle, your costs are gonna go through the roof because you're going to battle AbbVie's insurance, or you're not gonna be able to. You're gonna develop it for 7 years. Approved a year later, and you can't go to market with it for 6 more years.
Right. Because
you lost the fight.
AbbVie was waiting until the companies were ready to go to market before they would hit them with the lawsuits.
Yeah.
Or with the patent. I think that's what's disingenuous. Like there should be like a time where you can't file for any new patents. If you're making the Humira the same way, why at year 15 are you all of a sudden applying for this patent? That's what's a little disingenuous about it.
Yeah.
After 5 or 10 years, you can't file for a new patent.
Right.
But they do that. All the drug companies do. Well, now we're using it for this purpose, and we ran these clinical tests, extend our patent.
Yeah. That was one of the things that I read.
Why didn't you try that 5 years ago? You held that in your pocket.
These things do happen all the time, but the one article I read was talking about how AbbVie's taking it to a new level. Like this is really, nobody's ever done it. 300 patent attempts.
They're setting a new bar.
They're going, we're really going to protect this. I get it. They got to make a profit, and they certainly have made a profit. But man, it feels gross, and it doesn't help people. And I know they're not in the helping people business. They're in the making a profit business.
And they help people too. I mean, it is a novel product.
It's treating a crap ton of conditions.
Yeah, RA, psoriatic arthritis, rheumatoid arthritis, psoriatic arthritis, Crohn's, and ulcerative colitis. Again, it's back to
all those autoimmune.
Wow.
Yeah,
autoimmune and inflammation stuff. Wow. And it is the only thing on the market that does it in this way.
There are other things that are around for sure, including other things AbbVie makes. So that's part of what.
Wow.
So once the patent fight's over, they'll have these miracle studies about how much better Skyrizi is than Humira, and then they'll fight the fight that way.
Wow.
Yeah. But and again, I guess it's like it's twisted, but then it's like nudge. It's still, even though it's a little left of center, it's still nudging the ball forward with new meds, new treatments. But it is moving the ball forward at the expense of like elbowing your opponent in the jaw, basically.
Man,
and I guess to me, I always look at it because that's absolutely true. I'm generally a capitalist, for sure. And they need to make money and make a lot of money because they invested a ton of money.
Yeah.
No problem with that. It's just then I just think like a lot of things, it just goes a little too far.
Yeah.
And if you're trying to cut the head off at the beginning and say they should just never have made billions of dollars, I'm not with you on that.
Well, because AbbVie is helping people.
Yes. If you cut it off maybe lower down and you
Yeah.
say, hey, maybe the rebates and maybe 315 patents 15 years after you made the product, that's a little too far. That's maybe where I'd come in, you know?
Yeah. So
It's-
not opposed to making a profit,
No.
but boy, this hurt a lot of people.
Yeah, it's super.
Yeah,
super
more and more
crazy.
people with the high deductibles. We see it all the time.
And the thing is, this is another point that's worth repeating. We're beating up on AbbVie right now because they were in the news, but the reality is this is all of the major drug manufacturers. They all do things like
Yeah.
this. And so it's not, you shouldn't feel bad for whoever, Abbott or whoever that got elbowed, because next week they're going to be doing it to AbbVie
Sure.
Yeah.
for something else.
Yeah, it's not a new tactic.